I had like deep acne scars all through my childhood, and Dr. Ben suggested that I do TCA Cross for especially my skin color. That would be the best course of action, and yeah, it worked. After one session I saw like almost 20% improvement, and then I thought I'll do another one, so it's almost 50% gone now. I stopped getting pimples after I started taking Accutane. That really worked for me, but it left huge scars, like really deep pores. And the texture of my skin was not even because of that, and it always bothered me. And I also had hyperpigmentation, especially around those scars. And after the TCA Cross, I think the doctor also gave me a bleaching cream to even out the texture and the skin color, so it worked great. Especially, I guess, for like my skin color, it was an easy solution because I couldn't do like a fractional laser. So TCA worked great for me. So with the TCA, the treatment wasn't too painful. It's like a slight tingling. The recovery, I would say, takes around 10 days, like 5 days when you start flaking off after the frosting, and about 10 more days to kind of remove these leftover scars. Yeah, for the TCA, I think I saw results around 2 weeks, like 8 days. I could see like the before and after, and I could see the improvement. First, I got the TCA session, I think around November. I went back, did another session of TCA, so all in all 4 months. Yeah, I think COVID has been great in terms of hiding the scars, but after TCA you get the frosting, and yeah, I think wearing a mask helped with that because I could still go out and not worry about the leftover scars. But yeah, after treatment, yeah, my friends did tell me that my skin texture improved a lot and it's way more even now. Yeah. Really excited to go meet my friends again and show them my new skin. And actually my family already noticed that and they complimented me on that, so I'm excited to show this to my friends too. Yeah. Way more confident for sure. Just for acne scars, I would definitely recommend TCA Cross, especially if they are a darker skin color like me. It gives amazing results and there is no like permanent scarring with that, so that's good. From what the doctor told me is I'm too dark for CO2 Fraxel laser because I think it scars the tissue for darker skin people like me, and it leaves like scars which are permanent, so that's kind of scary. With TCA, it's less invasive, it's more topical, and there's lesser downtime than the fractional laser, and it gives great results. The only thing, I guess, you'll need more sessions compared to the laser. I had like medium to, I guess, deep scars, and I was recommended to do 6 TCA sessions, but I've seen great results with just 2. I'm gonna try again after like a month because I just got my PRP recently. I'm gonna try TCA again, and maybe I'll do like 5 or 6 to clear out the rest of the scars that I have. I was very self-conscious for sure when I had those deep pores, like scars left over from my teenage years, and I carried it all through my 20s. But yeah, I feel way more confident now than I did before. I only wish I had known about this treatment before, then I would have been more confident and gotten out before. Yeah. Oh, it was wonderful. He answered all my questions, and he took the time to explain to me different options in the beginning and why certain treatments wouldn't work and what would work for me. So yeah, he was really good to work with. Yeah. Initially, I thought I sort of gave up on my acne scars, and I just learned to live with it. But I'm really excited for the future, because if I get this improvement after 2 sessions, I can't wait to see what happens after 6 sessions.